Hi, my name is Rebecca DeSimone,
Hi, my name is Shada Abougarbouh.
and today we're going to be doing our presentation on why the homeless are a vulnerable population. So, what makes the homeless individuals a vulnerable population? Homelessness is often considered a vulnerable population due to a combination of factors that exacerbate the risks and challenges. So, it's not just one thing that causes people to be homeless. It could be multiple things, such as lack of shelter. Homelessness is often associated with physical and mental health issues, including chronic health conditions, substance use, and mental illness. Limited access to health services further compromise these issues. Poverty, homelessness, and poverty are closely intertwined. Limited financial resources make it difficult for homeless individuals to access the basic necessities that they might be in need of, such as food, clothing, and hygiene. Social isolation. Homelessness individuals often lack social support networks. This leads them to increased vulnerability to things such as exploitation, abuse, and neglect because they don't have the support necessary. Legal issues. Homeless individuals may encounter legal problems related to a variety of issues such as loitering, trespassing, and panhandling, further complicating their situation and reducing their ability to access resources and support. Limited access to resources as well. So this can restrict their access to things that we might not have problems accessing, such as education, job training, and employment opportunities. And this just perpetuates the cycle of poverty and homelessness. So that's what makes them vulnerable. Oftentimes we have these luxuries and we don't even think twice about them. All right, so why are they homeless? So this is a picture, it kind of breaks it down. There's multiple reasons. So one of the top ones being domestic and family violence, financial difficulties, housing crisis, inappropriate or inadequate dwellings, relationship or family breakdown, housing affordability, stress, and other reasons as well. So these all play a factor in why people are homeless. So the social determinants of health, we talked about this in community. This is what really affects the homeless people as well and makes them vulnerable because oftentimes they don't have access to education, especially education that is quality. They're lacking economic stability, social and community context, neighborhood built and environment, and most importantly, healthcare access and quality. So access and quality is something that is greatly impacting their health. And as a nurse, we need to help them get to the resources, which we'll be talking about in the further slides.
So, how many people are homelessness? According to the January 24 Times, count of a total of 10,267 people were homeless and increasing from 8,754 in 2022. The last time it surpassed 10,000 was in 2015, and in 2014, almost 12,000 people were homeless. That were counted. In the state of New Jersey, the point of time counted revealed 10,267 people were experiencing homelessness. It was noted that nearly 50% of unsheltered people live in the United States in California, which hold 12% of the population. In Los Angeles County, 59,000 people are homeless and 44,000 people are unsheltered. Indeed, homelessness is a widespread issue that affected the United States and its citizens. So here you can see the graph that shows how many people there's homeless in different places in the United States. Here you can see that Los Angeles has the most amount of homeless people, and the second one is New York City and counting on.
So what is homelessness? So we talked about the causes, but what is homelessness? So it could be defined as an individual or family who does not have a place of residence. So one could be living in places such as emergency shelters, transitional housing, or places that are not meant for habitation. So that can mean you could see homeless people on the streets, in parks. Causes consist of a lot of things, as we talked about in the prior slides, one of them being mental illness, domestic violence, lack of affordable healthcare, addiction, unemployment, lack of affordable housing, evictions, incarceration, poor physical health, stagnant wages, healthcare costs as well. So homelessness has a ripple effect on the community as it affects the availability of healthcare resources, as well as crime, safety, and use of tax dollars as well. So not only does it affect the homeless person, but the community as well, which is why we need to treat them. So it impacts the present as well as the future. So homelessness harms not only the individual, but as I said, the community, and the consequences are abundant. So they can consist of a lot of social consequences, medical consequences, behavioral, economic, moral, and a lot of them are immeasurable, which is why we really need to help them health-wise and find a place of living so they can get as healthy as they can be.
So here, this is just a picture of that shows homeless people in the streets. You know, they have just clutter next to them. They don't have any safe environment. They don't have any like personal space, and it's very hard for them. That's why they need to be sheltered. So why are homeless individuals vulnerable? So both sheltered and unsheltered homeless populations experience adverse health outcomes, as both living on the streets and in homeless shelters pose unique health risks to homeless individuals, including exposure to communicable diseases, harmful weather conditions, violence, drug use, and malnutrition. People experiencing homelessness also suffer from lack of parental guidance, relationships, increased exposure to criminals, and the ability to avoid dangerous areas. And as we all know, these are the factors that increase the individual's vulnerability to crime that include assaults, robbery, theft, vandalism, and sexual assault.
So here's a picture. So it just talks about the top health issues for homeless people since they're exposed to different issues than the normal population. So premature death. This could be caused by the fact that, as we talked about prior, a lot of these people are living on the streets. They're not adequately dressed. They don't have good hygiene as well. And they're really increasing their risk for communicable diseases that we don't have, such as TB and HIV, and they are not getting treatment. So that leads a factor, all these diseases and things that they're exposed to premature death, chronic diseases, accidental injuries as well, hunger and nutrition. Oftentimes they are not getting food, mental health issues, which they are not getting treated for, and permanent disability, chronic illness, infectious disease, and pain. So there are a lot of issues, and these issues aren't getting treated, which is why as nurses, we need to help and really just assess our community and find the people that need help so we can link them to the resources.
So, ways nurses can improve the vulnerable populations. As we all know, nurses can improve the homelessness issues by identifying the homeless people, just like Rebecca said, within the community, linking them to necessary items and services. Nurses can provide them with clothing, phone calls, transportation, job opportunities, and several survival kits containing items for cold and hot weather. Moreover, nurses can assess the state of their health, such as infections, malnutrition, vaccination status. So here you can see the nurse is taking care of someone. I'm assuming that they're homeless. They're just, cleaning the homeless people's feet because, they don't get the proper foot care or any kind of care. So it's important that these patients get the proper care that they need so they don't have more issues down the future.
So, when interacting with a vulnerable population, such as the homeless, it is important as a nurse to use a very holistic, nice, friendly, non confrontational approach, establish trust, assess both their immediate needs, so their physical health needs, and then their long term care needs, such as housing, healthcare resources. And what's very important within these situations for nurses is providing trauma-informed care. Because a lot of times these people, they don't have, like, they haven't gone through normal situations. So just really being understanding and using that therapeutic communication to support them and whatever they have gone through, not judge them, what has happened prior to this to lead them to this point. And our job is really just to advocate for the homeless patients. We are their voice. A lot of the times they don't know how to meet their needs, so we just really have to assess and advocate for them. So, a response approach to homelessness within the community. So, I found this. So, this is a response plan that can be used, and it's a good little like map and reference. So, what could be used to respond as people and nurses within the community is doing weekly cleanups, partnerships with local nonprofit organizations, secured grant funding to support homeless services, highway cleanups, um, dedicated public safety and code enforcement teams, constructing low barrier emergency shelters. So as nurses, we can really advocate and become members of the community to help the vulnerable population.
So the role of the community nurse. Community nurses conduct comprehensive health assessments for homeless individuals, identifying their immediate health concerns as well as underlying medical conditions. Nurses educate homeless individuals about preventative health measures, managing chronic conditions, and assessing healthcare services available in the community. Community nurses administer basic healthcare services such as wound care, medication management, and vaccinations directly to homeless individuals, often in a shelter or community centers. Nurses, they facilitate referrals to other healthcare providers and social service agencies, ensuring homeless individuals have access to a full range of support they need, including mental health services, substance abuse treatment, and housing assistance. Community nurses advocate for the right and needs for the homeless individuals within the healthcare system, helping to remove barriers to healthcare access and addressing systemic issues that contribute to homeless and poor health outcomes. They provide emotional support and counseling to homeless individuals, addressing issues such as drama, substance abuse, and mental health challenges. This is very important because a lot of these homeless people, they're going through a lot of things. So it's a priority for the nurse to address mental health, and it's very important, as well as community nurses ensure continually of care following up with homeless individuals after initial assessment or treatments, monitoring their progress and adjusting plans as needed. So after a nurse refers patients to resources, it's important for the community nurse to go back to the patient and ask them how it went, just to see if they did get the proper care and if they need help with different resources, because as a nurse's role, as I said, is to advocate for the patients and make sure they are getting the proper treatments.
So ways nurses can promote health equity is through interventions and reforms that influence the institutions, social systems, and public policies that drive health. By incorporating use of telehealth, as we talked about, it's a good resource if possible. If homeless people have access to devices, as oftentimes it's a struggle for them to get into the clinic. So that could be useful, and visits to the patient, obviously, if possible. So our goal as nurses are to identify things within the community and healthcare resources that can be reformed and help homeless people get access to them and make things more accessible. Because as we know, healthcare can be expensive and hard to access. So that's important to think about when helping a vulnerable population. So programs and resources nurses within the healthcare system can use to help homeless people within the community. So there are a lot of resources. So there are multiple resources available to address vulnerable populations. So you may have heard of the Substance Abuse and Mental Health Service Administration, is one of the leading federal agencies addressing the issue of housing stability for individuals that have serious mental illness. In addition, the U.S. Department of Housing and Urban Development and the United States Integrity Council on Homelessness. So there is a Center for Mental Health Services. So there is PATH, which projects assistance in transition for homelessness, treatment for individuals experiencing homelessness, SSI and SSDI outreach, access, and recovery for patients that have substance abuse issues. Healthy transitions, so improving life trajectories for youth and young adults with serious mental health disorders, and centers for substance abuse treatment, because often the homelessness population, not all of them, they can have issues with substance abuse treatment. So there is a grant for benefit of homelessness individuals and minority HIV/AIDS fund. So an integrated behavioral health and HIV care for unsheltered populations, since this vulnerable population is at risk for things such as HIV and AIDS. So here I have pictures of the program, such as the SOAR program, which I talked about before, which I thought was really, really great. It helps people across the lifespan that are homeless or just people in general with substance issues. It helps them get the resources as needed, as well as PATH that you can see.
So continued programs and resources. Supplemental Nutrition Assistance Program is called SNAP, as well as like food stamps, food banks, homeless services groups, legal assistance, Social Security administrations, Department of Veterans Affairs, resources for homeless veterans, local resources for homeless veterans, shelter, homelessness hotline. Homeless hotline. So these are our references, and just to wrap things up, what we took from this after doing this project is that we became aware of how many people are homeless in our community and how it's important that we address them as well, and to always tell them that things can get better, and we have to advocate for them as nurses and give them all these resources and tell them like things can get better and to advocate.
Yes, it's more than just one factor. There's a lot of factors, and that's why we have to stay educated. And that's why, as nurses, we are their advocates and we can link them to great resources as well and really help them with their health issues. We can provide primary prevention, we can treat tertiary prevention as well, but our goal is to really get this vulnerable population, like the regular population, have them linked to the healthcare resources that they need, try to get them jobs, try to get their health as great as possible so they can function in society, and so they're not on the streets or just out in the public, and they're not at risk for all these health issues as well. And when talking to these patients, we need to talk to them therapeutically because we really don't know what they have gone through. They may not want to share, they might be embarrassed as well, so we really have to be just very, very therapeutic
Non-judgmental.
and non-judgmental as
That's the
well.
most important. And addressing their mental health needs as priority to, and just treating them like normal patients. We cannot be biased with our with our care. We have to treat everyone the same, and that's what will make us better nurses.
Mhm.
And just to summarize everything up, these are our references, and thank you very much.
Thank you.